Hey everybody, welcome to Beauty Inside and Out. We are progressing rapidly through the summer months and heading into fall before we know it. But first, there's always that opportunity that we want to be able to finish the year out looking our best or going into the next year looking our best. And I know as a consumer to beauty products myself, I'm challenged by what I can do to keep a very youthful look, what I can do, what I can afford, who can I trust, who do I need to talk to. I'm your resource to be able to bring some of the most talented and technically savvy people to this show so that these will be the questions that we can ask, and we'll also get the answers from our guests today. So let me introduce my guests because I've got three fabulous people here with me today. We have Dr. Jason Emer, and he's a board-certified dermatologist, and he specializes in laser and procedural dermatology. And we'll get a little bit more into in-depth to each of you guys as we kind of progress through the show a little bit, okay? And then please, I'd like you to meet Kimberly Clark, or Kim Clark as she goes by. She's an accomplished and recognized advanced esthetician. And she also has not only been doing this for over 20 years, but she also has a clinic national where she teaches some of the services that she does, as well as provides some of the services. And you're up in the Pacific Northwest, from what I understand, right, Kim?
Yes.
All right. And then finally, we have Dr. Robert Cohen, and he is from Scottsdale, Arizona. Woohoo, that's my hometown. And practiced plastic surgeon in that particular area, but then not only in his advanced training, but he went to prestigious institutes. And it looks like after you graduated from Phoenix Country Day School, you attended Emory University in Atlanta. Woohoo, that's where I'm at now. And got a double major in biology and philosophy, and graduated, of course, top 12% in your class. So we have lots of wealth, lots of knowledge, and lots of beauty experts here.
Just to add in, I'm also practicing right now, mostly in Los Angeles with Dr. Emer.
Yeah, so you've got not only in Scottsdale, but you're also doing some work in Los Angeles as well. And Dr. Emer, that's where you're located, is in Los Angeles, correct?
Yeah, we're in Los Angeles, but now we're also going to New York and Miami, and I'm trying to get Dr. Cohen there too, so that he's all over the country.
Perfect. And Dr. Cohen, just real quick, what's your main specialty that you do?
So I do aesthetic plastic surgery, focusing on the breast and body, but what I'm particularly known for is breast surgery of all kinds, whether it's revisions or complicated surgeries, augmentations, all that kind of stuff.
Perfect, good. I definitely am excited to dive into that because there's a lot of questions around that for women today, right? All right, but first, what I'd like to do, I'd like to start with Dr. Emer here. So as a board-certified dermatologist and what you're specializing in, I'm most curious about what sets you apart, because it seems like this is a very growing category for doctors to specialize in, kind of this cosmetic surgery and beauty treatments.
Yeah, I mean, the industry right now is changing a lot because people are wanting a lot of quick fixes with a minimal downtime. So there's all these devices that are coming out and injectables that are really quick and easy. And unfortunately, people who are inexperienced or who don't have a lot of knowledge are kind of doing these procedures. So they're more readily available to everybody. When I did my training, I did a very intense certification for dermatology. It was a complete residency. And then 2 different fellowships, which did skin cancer surgery, laser surgery, liposuction, and basically cosmetic facial surgery. We used to do facelifts, eyelid surgeries, grafting. So there's a lot of knowledge there when it comes to knowing devices, understanding surgery. My practice now has evolved from doing any medical dermatology to doing all cosmetics. We actually do all the research for all the laser companies and developing new lasers. Whether it's anti-aging, skin cancer, scarring, even Dr. Cohen and I, we go back and forth all the time about treating scars because I did a lot of research at the beginning and using lasers to treat scars after surgery. The thing I'm really well known for is combination therapies. Before people started doing all these mixtures of things to get improvement, I was literally booed off the stage at the American Academy of Dermatology when I talked about combining a laser with a microneedle at the same time. And that was 5 years ago. Fast forward to actually my anniversary, which was 2 days ago, 5 years in Los Angeles. We now are doing 5-6 treatments at once to get an amazing outcome. And I'm really known for that type of treatment. Now, when it comes to the face, it's lasers, it's fillers, it's peels, it's skin care, it's skin tightening, all combined to get a lot of good improvement. When it comes to the body, it's a liposuction combined with fat grafting or sculpting. And then this is where Dr. Cohen comes in and our plastic surgery team, but obviously is the best, is skin removal, breast reconstruction, and implants, giving people complete transformations. Because if you look at previous years, you can get an improvement, but it wasn't like a dramatic sculpting and defining. Now, Dr. Cohen and I have been refining what people have done kind of outside the United States for many years, and combining plastic surgery and then the liposuction body contouring together to get like transformations you've never seen before. I mean, even on my Instagram, just now I did a lymphatic massage. We showed a lymphatic massage of a patient of ours a couple days ago who literally went from being large problem areas and sagging skin to having what looks like he worked out for 5 years. And you never saw that in the past. So we're known in Los Angeles, at least now, and now throughout the United States, I think, as being innovative and progressive when it comes to combination therapies, being very meticulous. And you can't replace that by going to a weekend course. And you can't replace that even going through a full residency. You have to do other trainings and beyond, which is what is going to set people apart. And I think that we'll talk about that in the growing trends, but as more and more devices come out and people want quick fixes, there's going to be more revision procedures that need to be done by the people like us who are very experienced, because we know what's truly needed, and people sometimes will be finding out too late.
Yeah, I get that. And I like the fact that you do the combination therapies, and they seem like they're all somewhat of a non-invasive approach, which I know, as a consumer, these are the things that we're demanding. These are the things that we want. I can't even imagine trying to take time off for an actual like surgery.
Well, 50% of what I do is all the non-invasives. I study all the skin tightening treatments before they come out, the lasers, the injectables. The other 50% is the stuff that you do need to take a little bit of downtime for, whether it's body surgery, the tummy tucks and the implants and facelifts and stuff, but people are ready for those when they prepare for them. Yes. The other ones are the people that just want to stay refreshed. They want to, I always tell people you're either going to do a clock stopper, which is something that slows it down, or you're going to try and reverse. If we're doing clock stoppers, it's more frequent treatments, it's more non-invasive, minimal downtime. If we're trying to reverse, it's going to be a little bit more, and you got to be ready to do that,
Yes,
but there's a desire, I think, for all of those. You'd be surprised. People will come in and say on their intake, no downtime, minimal, and I get them to do a facelift because they need it.
I think once they talk to you and they start to feel more comfortable and they feel like, first of all, if they're at that point, they're ready to take on something, and they probably don't know exactly what's going to be the best option for them anyway.
And that's the thing, is that the trust factor and the compassion factor with the doctor. I sometimes have to kick Dr. Cohen. I knock on his door because he'll spend an hour or two with the patient, which I love, because people want to connect with him. And when people do that, they trust you with anything that you say. So even the other day, I had a patient with very severe acne scars, but she's a little bit older and has looseness. And if you actually lifted her skin, 50% of the acne scars are almost gone. And that was all from the sagging and the laxity and the lost volume. So if she actually did a facelift, she would get more than lasers, more than fillers, if she actually did a facelift for the scars. She didn't even know that that was a possibility. Yeah. So sometimes when people come in, it's just honesty and being compassionate and being really upfront. And when you do that, they're willing to kind of go through the treatment plan and make a decision. Some patients will, say, look, I'm never going to have surgery. And they just look great for their age. And we slow it down. And we'll use new devices that will give them a glow and help their pores and, finesse some of the fine lines and tighten the skin a little bit. But some of them want these big transformations that Dr. Cohen and I are doing. I mean, he'll tell you how many revision cases he's doing of breasts where these people have said the result was good. And then you see what Dr. Cohen does, and it's like a magician. It's like, I didn't even know that the nipples pointing down was bad. Now it's straight ahead and it looks perfect. Like that type of thing. You don't realize it until you actually get into that, in face-to-face with an expert that understands the fine-tuning and the subtleness and all the intricate work. When people notice that and they see these types of podcasts and videos and they learn about those people, they get excited and they're willing to trust but that's what people want now. They want this really high quality work in the age of when things are really quick and easy. And so you have to train them to understand the differences. I even said to my patient today, who Dr. Cohen and I did surgery on a couple days ago, I said, what did you expect as the result? And his answer was, not this. I can't even believe what I got. Because people don't realize the amount of the degree of improvement you can actually get when you go to someone who's really well trained and knows what they're doing.
Or when you're combining two people's skill sets like ours to create something that neither of us can do on our own. It's some of the parts are greater than the whole is greater than some of the parts, I guess you could say, in that situation.
Yeah, I mean, in this case, for example, with the body contouring in males, we're seeing a very frequent number of patients coming in having liposuction in the chest, and then they get sagging, they get indentations afterwards because they didn't do the fat grafting that we do to the muscle, or give an implant, or even lift the chest when some people need it. And that is something no one's really ever done before. I'm not trained to do that portion of the surgery. So as my practice developed and I needed to get better and better at these sculpting procedures, I needed Dr. Cohen. And that's together, and that's the thing, in the age of, like I said, people wanting to be known for this, I want it to be a team approach. People feel more confident when they have a numerous amount of providers for them, looking at them at all angles and giving them a better as a teamwork. I think people like that more. So I feel very happy when we work together and get these great, amazing results. 1 year, 3 years ago, didn't get the same results. Mm-hmm. Now the results have progressed because we've been combining our expertise and skill.
Yeah, that's fantastic. And it sounds like you really do cater to what the patient's needs are, which, I think that's a scary part for most people when they set up that initial consultation. They fear being sold something they don't need. They fear not looking like themselves in the end. And so the trust factor is really big with you guys being able to work together and say, here's what it's going to look like. And then, of course, exceed their expectations.
The hard part is, I think at the beginning is when some people assessing the amount of honesty, because I'm very blunt and very honest. I had a man come in the other day in his mid-50s and he wanted skin tightening procedures. He needs a facelift. I told him I wouldn't even tell him to do thermogeral therapy because it's not going to give him a result. It would only slow it down, so he'll see nothing. So if he was able to spend the money to see nothing but be preventative, he could do that. Yeah. And he appreciated that. But I've had patients write reviews online saying, he told me I needed a facelift when I look great. Well, maybe you do look great. But if you actually needed the facelift for the result you were looking for, I'm just being honest. And so, about 95% of the people, I think, are happy because I tell them not to do a laser. I have 80 lasers. I could tell anyone to do any laser, and we could bring in money from that. I don't do it because of that. I do it because I want to see a really good result. And if somebody said, I'm never going to have surgery, then we give them an option. But if a woman comes in and her breasts are down to her waist and she wants to do a lift without doing cutting, it's impossible,
Yeah,
but that
absolutely.
is tell you. So
I noticed, Dr. Emer, that you are mentioning a lot of men. So it sounds like men are getting more treatments and more surgeries and are more actively engaged in looking good.
Yeah, you'd be so surprised. Before, I always thought it was the business professionals and models because those were the people that were more forward facing. Now I seem to have women will come in with their significant others and they're doing the monthly facials, they're doing the skincare, they're asking about their pores. I never had guys ask about pores 2-3 years ago. It was like never occurred. Now I have people in their 20s come in and say, should I be doing Botox preventatively? Should I be getting a strong laser once a year? I mean, they understand that like their teeth or their hair, they have to do it consistently to stay looking young. And they're coming in more. Our practice happens to be about 65% men. Dr. Cohen's doing a lot more men lately because we're doing a lot of chest surgery and body surgeries and big transformations. But when before he's probably doing more women's breasts.
Female before probably.
Yeah, I see that trend happening for sure. Yeah.
But I think, and the other thing too is baby boomers there's more of a divorce rate too. So people start wanting to, they're maybe getting back into the dating scene and they're going on apps. They got to look good in and out of their clothes. Before it was do surgery to just look good in your clothes. And then scars were high and you'd have to turn off the lights. Now it's really, being happy taking your clothes off. We did a case a year ago of a woman's revision, tummy tuck, and lipo. I saw her a year later with Dr. Cohen. We did a revision and her liposuction. She was almost 70. And she hadn't dated in, I think, in 15, 20 years of having a divorce or her husband passing away. So she redid her surgery. Within a year, she already had 2 boyfriends. And it's the happiest woman I've ever seen.
I believe this. There's a lot of dating in our 50s.
It's every age, it's every age. And the thing is, and I think men are starting to recognize it too, that if they go to somebody good, it's subtle enhancements, that it's just an improvement in a glow of the way they look, and they just feel more radiant. They feel more presentable. They get nervous at first because they think of the surgeries from the past, like in the 80s when facelifts were pulled or faces look waxy.
Mm-hmm.
Now we have subtle fillers that are soft. They're not rubbery. They don't give too much volume. They just give like a plumping effect. We have the lasers that just slightly, smoothen things out. And then surgery wise, you can hide scars. You can literally hide and then laser the scars. So there's so much you can do.
That's awesome. Kim, I want to ask you in regards to this, because I'm not sure that our listeners are really clear based on what Dr. Emer has been sharing, and then you having an advanced aesthetic background. What are some of the procedures that you can do within your facility that wouldn't have patients necessarily going to a medical or a medi-spa approach?
I usually do a lot of microneedling, which that's probably my favorite thing to do.
What is it?
With or without PRP.
Okay.
Platelet-rich plasma.
Mm-hmm.
And a lot of IPL photofacials for hyperpigmentation. I get so many clients that have sun damage from usually caused when they were younger, if they've lived, somewhere else. Like coming into Oregon, there's not a lot of sun here. So people that have grown up here usually don't have a lot, but I see people all the time coming up from California and Arizona here that I can tell where they're coming from just from looking at their face and seeing that damage. So I like to alternate back and forth between microneedling and IPL photofacials.
Will you define microneedling? Because I think that it's one of those names that if you just said it to a consumer, they probably wouldn't have an understanding of that.
Okay, so what it does is it creates little micro channels, and whatever I put on the skin, it could be hyaluronic acid or PRP, it actually drives that deeper into the skin. And that regenerates collagen production. It's basically telling your body that there's some damage, and it's sending, like fibroblasts and everything up to repair that damage, which causes collagen production. That's the anti-aging part of it.
And is that like a machine that just does this little microneedling?
Yes.
Okay.
It almost looks like a pen, and on the end of the pen, there's usually, the one I have has 12 needles that go up and down on the skin. And you run it over the entire face. So you're numbed pretty well. You don't feel much. And
is there can you see it? Can you see the marks on it after you have that treatment?
There's some swelling and some redness.
Okay.
It usually takes 24 to 48 hours to go away.
All right. Not so bad. Not so bad then. And then I like the idea that I've had some photofacials done before, because definitely growing up in Arizona, sun damage, is a factor there. And of course, now I have a boat in the Caribbean, so I'm constantly in the sun and try to be very protective and find ways to be preventative. But, some of the damage is done. So I'm going to be visiting some of you guys soon. I promise. Yeah. All right. So then tell us a little bit, because one of the other things that you're doing here is you're not just providing services for some of your clientele, you're teaching people to be able to also train them on being estheticians.
I usually work actually with nurses and doctors that are going into doing the injectables, Botox and fillers, and just kind of educating them on the skincare part of it, which involves the lasers and microneedling and just skincare in general.
Yeah. Well, Kim she's definitely proof of it. She has beautiful skin. For those of you that are on video, you can see that. But for my listeners that are just on the podcast with us today, you probably can't see how fantastic all my guests look today. But Kim's skin is glowing. And I know one of the things, Kim, is that you feel like everybody deserves to have this glowing skin. What would you recommend we do as something right now that we could get started doing right now today to have better glowing skin?
You know, daily care is really important, and I feel like a lot of people out there don't realize that what you put and use on your skin every single day has a huge impact on how your skin is going to look. It's kind of like, I relate it to like insurance for your skin. If I'm doing a treatment on you and you go home and are using something that I have no idea what's in it, or over-the-counter product, it can actually cause more damage than good. And so I always stress that using a medical grade skincare is very important. So it doesn't just sit on top of your skin, it's actually getting down into the dermis.
Yeah. And what are those products that you would recommend for somebody to have as part of this regime that they should be doing daily?
Something in the morning, I always say something with vitamin C, and a good quality vitamin C to fight free radicals, and it brightens the skin also. At night, I like retinol, and that's good for cell turnover and to also brighten the skin, good for fine lines and wrinkles, smoothing everything out.
And when would you recommend that people start actually doing this skincare regime?
As soon as possible.
So young.
Very young. And sunscreen. If someone were to ask me what's the one thing I should be using every day, and just one thing, it would be sunscreen. Prevention.
Yeah, I think that's an industry that needs a little bit of an overhaul and I've worked with some companies that produce some really great skincare products that are under the sunscreen element, but some of them are so greasy. Some of them make you break out. It's like, then you can't put makeup on, or you can't kind of be in that normal environment with them. So I feel like that's an area of opportunity, especially now that we're trying to be reef friendly and we're trying to get rid of some of these ingredients that are bad for the oceans and environment. So hopefully they'll get that, or maybe you guys will create something that'll be fantastic for that. Good. All right. You guys, we're going to take a break here in just a couple of minutes, but I want to ask a question just for all of you. When we come back from the break, we're definitely going to tap into Dr. Cohen here. But I know you're all you're dedicated to the profession you're doing, but you know what my listeners really want to know? They want to know what the celebrities are doing to have the fantastic looking figures and skin. Like, what are these things that you could say, do this, and this is going to give you this, especially like when you get into that awards time of year, it's like they're all glowing. They're all fantastic looking, and they're all doing something. What are they doing? And we'll start with you.
Ooh.
Oh, Dr. Emer.
Well, I'll tell you, everybody comes in asking, can I look like J-Lo? Can I look like Jennifer Aniston? Can I look like Rihanna? Can I look like Beyonce? And I always tell them, look, they're following treatment plans, all of them. Like you said, daily care, they're using skincare every day. A retinol at night, a sunscreen in the morning, vitamin C, kojic acid, anything that brightens the skin and protects the skin from sun damage. They're doing skin tightening procedures, meaning once or twice a year, things that heat the skin and tighten it, like radio frequency or ultrasound, thermodular therapy, just to kind of slow it down. Jennifer Aniston's actually been in the news talking about Clear and Brilliant and Thermage. Those are very light heating treatments. Clear and Brilliant's a laser to just exfoliate the skin lightly. You look good in a day or two. Some people do it a day or two before the red carpet events. They're doing facials twice a month, if sometimes they're not even a little more, with antioxidants infusions at the same time. They're doing little micro droplets of filler to give an enhancement. Everyone talks about Bella Hadid's cheeks and Sandra Bullock's jawline, lips. Obviously, now the fillers have changed to be very subtle and natural versus very plump and overdone. And Botox, obviously preventative for movement lines to get brow lifting and help the neck bands. So it's a mixture of things. I always tell people it's skin texture, color, and tone. That's your peels, your facials, and your skincare. It's skin tightening to prevent laxity, That could be energy treatments. That could be threads. That could be mini lifts. There's a new procedure called face tight that goes under the skin and heats it. I cannot tell you how many women and men that want contouring of their jawline but don't want a facelift or a neck lift.
Yeah.
So doing face tight.
I'm ready.
Filler, yeah, and they get, wait, for a lift or for face tight? You can come in face tight anytime you want. Because it's a weekend of downtime. It's so minimal.
I could do that. I could do a weekend
and
of
people
downtime.
love it, and they think, yes, it's only maybe a 2 or 3 year improvement compared to a lift, which would be 10 or 20, but it looks good. And then we're talking about the movement lines, which is the Botox, and then deciding on true surgery or not. A lot of the women, when I started working with Dr. Cohen, I couldn't believe these lifts that he was doing with some fat grafting. And within a weekend, they're like walking like nothing happened. Because scars are so precise under the skin, and he's using their own fat to give volume rather than an implant, so it doesn't disrupt things as much.
I can't wait to hear more about that.
Yeah, he can talk about that combination, because a lot of women are wanting things like that. The big body thing that people are doing now is sculpture injections, which builds collagen over time for cellulite and for shaping of their buttock. And then they're doing radio frequency treatments. There's a lot of energy devices, Forma, Contura.
A lot of that,
Yeah, I mean, you see videos all the time. They're doing this consistently a few times a month. And then internally, that face tight, there's a body tight. And that actually in the right hands gives amazing improvement in the lateral thighs, the inner thigh, the arms. So award season comes 2 months before. People are doing body tight or Renuvion J Plasma under their arms to get tightening, or things like True Sculpt and Cool Sculpting, which are non-surgical, and you can go right back to the gym. So it's literally so many combinations.
That was way too many choices.
I know, but
I agree. They're probably doing them all. And, I'll ask you guys these questions, but we're going to have to take a quick break here real fast. But when we come back, I'll ask you the same questions, and then we'll talk with Dr. Cohen as well. So stay with us, you guys, because we're talking about beauty all from the inside out and from head to toe today. Stay with us.
Exactly.